We talk about healthcare. We talk about the elderly. How how do we improve that as far as persons, nurses, doctors, trained technicians?
Well, one of and you can see already the impact on the territory with the situation with nurses. We dedicated quite a bit of resources to educating our nurses. We now have a school of nursing at the university, and we're producing more graduates. I went to both of the ceremonies this year for the registered nurses coming into the profession, as well as the licensed practical nurses coming out of the health center, the skill centers, and so forth. The same thing is possible with a school of medicine. The data shows that where people are educated, there's a greater likelihood that they will stay. When you have a medical school in your area, there are all these ancillary industries that spring up. So you have both an economic and a health benefit to having an institution like that in your territory. The coming back online of the Kimmelman Center is a really, really important element because of the amount of cancer that's in our society. And why we want to pay really specific attention to our medical facilities is that, some persons think the solution is to you get a diagnosis of something and you hop on a plane and you go to the States and you get quote unquote better medical care. But healing is not just about medicine, and healing is not just about facilities. Healing is also about having your family around you, getting nurtured and cared for in a place that you love and where you want to be. So our focus is on making sure, number one, ain't everybody could jump up and travel away to get the care, but that you get care where you live. You don't know what it means to make your brother or your sister can come to the hospital and make sure that you eat your meal and maybe even help you eat it. Make sure that you're not sitting there in a room with your tray covered over and you've left the food, and then when you finish, you just come and take it away. So there is such a benefit to having care in your home. And that's why we want to put an emphasis on completing these facilities so that that can happen. And then those other things that we point to, we have the statistic is that there are 11,000 people every day in this country who turn 65. And you can see that in the territory just as well. And so the emphasis that we're putting on caregivers, increasing the possibility of that service being provided. Homemakers, that where elderly persons are living alone, they have the assistance of human services department persons coming into the home and helping with their home care services. The centers, reopening them, or when these centers were operating, they had transportation. They could pick some of these seniors up and bring them to the center. There were days that they would take them to the mall, as an example, so that if they needed to pick up things, they could do that and then go home. The Meals on Wheels, strengthening that program. These are some of the things that we want to see take place.